yeah, we're going to open things up for questions, and we've got a number of things that should provoke questions. So hopefully we'll get a few out of the audience here. And yes, over here.
I work for Dearborn Heights School District number 7 in Dearborn Heights, Michigan, and they hired a environmental consulting firm after we discovered, the custodians discovered from sanding asbestos tile floor, that it was, we've been told repeatedly by this company that if it's under 1% that we are safe. We've actually also been told by this environmental company, we have a main road on by our neighborhood, that we get more asbestos exposure just from the release of brake pads in daily traffic than what we get by going through these schools. So what I'm hearing is that there is no safe level. I want to make sure that that's confirmed to take back to tell them.
Not only is it confirmed, the World Health Organization says this, NIOSH says this, EPA says this. Every major scientific organization around the world has concluded that there is no safe level. The International Agency for Cancer has concluded this in their latest monograph. So it's a bunch of bunk that the 1%, under 1% is safe. This is something that dates back to the EPA regulations that exempted products with less than 1%, but it's still no safe level, and you should not believe that.
Thank you.
Dr.
Thank
Frank?
you.
Yeah, just to add to that, what is legally allowable under a regulation doesn't necessarily mean it's safe. And what you might do to print something out for them to look at, I mean, Dick's given you all the proper references, but on the OSHA website, and that controls workplaces, 2004, they had an asbestos statement, and there is no known safe level of exposure to asbestos. Interestingly enough, there were asbestos company medical directors that 50 years ago were saying the same thing. When it takes literally as little as 1 day of exposure to ultimately give people mesotheliomas, it's bunk.
And
Thank you.
Teresa, I want to make 2 quick comments. One is, I think it's really important to know that that's an AHERA violation. Those laws were passed in 85 or 86. And how many trade unions do we have in the audience today? Can you raise your hand? Because that is where you're going to find strength, the people to hold employers accountable. So take charge. And Celeste is fabulous, I know.
Thank you.
Thank you, Teresa.
Yeah, thank you. Are there other questions? In the back here.
I know you can hear me.
But we need it for recording purposes.
Okay.
We need it for recording.
Excuse me, I'm busy.
Aw.
Okay, coming from the fiberglass insulation industry years back, I know back in the late 80s, early 90s, John Mansell did do testing on longer fibers as being a carcinogen like the asbestos that they were manufacturing. Now, has any further testing been done since then, or does anybody have any facts showing that the testing that Mansell did do may not be correct?
Well, I think there's been a history of people saying long fibers are more carcinogenic, which may be true, but there are also studies out there that show that the short fibers, less than 5 microns, and the less than 5 micron in length fiber is a regulatory fiber. It's not an indication of safe fiber. And we now see from the North Carolina cohort of asbestos workers that have been followed over many, many years that even the short fibers are causing an increase in lung cancer and other asbestos-related diseases. So there is continued observation and surveillance and looking at short fibers versus long fibers. So there is continued testing. I hope that answers your question, but Arthur may have more to say about that.
Just to add a little something to that, the other point is that fibrous glass materials may well be a cause of producing mesotheliomas. There clearly is evidence in animals of that. There are many fibers which is why many of us think it's the fiber dimension rather than the chemical makeup of fibers that end up doing this. The reason we haven't seen the same outbreak of disease with fibrous glass products is they're of a very different size. The fiberglass products that are generally used are very large and end up not getting down into the airways in humans and therefore don't get out to the pleura. For years, many of us have looked at the data that's out there and haven't really seen and haven't been convinced that even though we have seen it in animals, we have yet to really see fibrous glass products or other, as they are now used, very large fibers actually causing disease.
One of the other things I might add, that the fiberglass, as far as disease potential, is an easy remedy. You can largely engineer it out by creating larger unrespirable fibers so that this can be prevented in the fiberglass industry.
Thank you. Let's take the next one.
Okay, thank you. I have both a comment and a question to the young lady from the school district. Your environmental consultant hired by your school district, in my opinion, is either an idiot or a liar, or both. And secondly, my question is, what do we know about the incidence of lung cancer and asbestos exposure? There's been a lot of debate about the incidence of lung cancer and the relationship to exposure to asbestos versus other lung cancer-inducing agents, primarily smoking.
Well, actually, lung cancer, asbestos causes more lung cancer than it does mesothelioma. Lung cancer is the leading cancer associated with asbestos exposure. There's no doubt about it. It's probably 2 to 4 times greater than mesothelioma. So, and the continuing studies that are looking at the epidemiology of asbestos-related disease are looking at lung cancer. And this is a major disease, oftentimes complicated by the fact that people smoke. And the smoking history, as Dr. Selikoff showed so many years ago, is synergistic. And I think Dr. Markovich, who's here today, can talk much more about that. But he's done more recent research to show the extent of smoking in asbestos, and also has looked at lung cancer. So I would defer further comment to Arthur and to Dr. Markovich.
Yeah, clearly I agree with Dick that more lung cancers result from asbestos than mesotheliomas. The problem is you've got not only smoking, which, because so many more people are exposed to cigarettes than they are to asbestos, that's where most lung cancers occur. The Surgeon General's figures are in the range of 85 to 90%. And then you have probably 24 other well-recognized lung carcinogens, many that show up in workplaces, anything from arsenic to certain kinds of woodworking activities. So that, from A to almost Z, we have many other things. What needs to be remembered, and Dick mentioned this, and Steve Markowitz indeed has studied this subject, is the synergistic or additive effect. It varies by population, and when people have looked, that asbestos is still a leading contributor, and in those cases where it's argued, well, somebody was a smoker, it's all cigarettes, the asbestos had nothing to do with it. Clearly, that's another situation like we have with the people in Dearborn. It's bunk.
Rob, I want to point you to a document that we use all the time. It's from the World Health Organization. It's their latest chrysotile report, and they use a ratio of 6 to 1 for lung cancer to mesothelioma. And in the United States, ADAO uses a factor of 4 to 1. So we attribute 15,000 deaths every year, primarily, as Richard says, from lung cancer, but that's how we derive our numbers.
We are done, I do believe. So. No other questions. Oh, one more. Oh, yeah.
Good morning. Dr. Frank mentioned earlier about India not finding any mesothelioma rates, but we see more and more in the U.S. Government fund or industry funded science. And I'm wondering from Dr. Lemon and Linda and Dr. Frank, if you have any words of advice on how we keep that exposed. We see more and more industry-funded science also through their experts on science And then we have teachers who are asking, well, what do I believe on that as well? And I'm just wondering, any words of wisdom to keep them honest, and when we have science going out there that may be bad science or biased science there, and to suggest certain types of asbestos are safe.
Yeah, for those of you that want to read about that issue in greater depth, thank you for the question, Ann. I suggest David Michael's book, Doubt is Their Product. You can understand the background of this. The problem is, you know, there are many industries that are still concerned because of litigation over past exposures to asbestos. And unfortunately, they seed the literature with articles that on their face look to be good, but aren't. There's also just gross dishonesty, making statements that don't exist, quoting other papers with statements they claim are there that don't exist. And so it is left to scientists in the community that are concerned about asbestos, like Dick, myself, the members of the Collegium Ramazzini, and many others, to call out these problems. So you see more letters to the editor about this, you see commentaries about this, and you see that when it plays out in court, because there's such fallacy to this, it's relatively easily debunked. But that hasn't stopped industry and you know, again, without going into the details, literally paying tens of millions of dollars to create this so-called doubt science. They realize they can't say that asbestos isn't harmful. It's either not ours or not in this product or not in the way it's used, et cetera.
I might add that there's a new book out besides Dr. Michael's. It's called Corporate Ties That Bind, and it's an examination of corporate manipulation and vested interests in public health. It's by Martin Walker. You can get it on Amazon.com. It just came out in the last few weeks. And Jacques McCullough, who from Australia, has an excellent chapter in there about asbestos and how the science is being manipulated by the corporate interests. So if you want to buy a book and read about from Jacques' article, I highly commend you to do that.
And I want to touch on a quick point. Your question, and you heard obviously Teresa's, question to us. We want to make sure that people in the audience and around the world can come to ADAO and find the information. So we actually had a conversation with our boards yesterday about building a depository. So in the meantime, we will be putting out the documents that we commonly use, whether it's in a hearing or to back up our citations. So we want it to be abundantly clear and enormously easy for people to get the right information, because all 6 types of asbestos, including chrysotile, are known carcinogen, and there's no safe level. The facts are simple, and Teresa, we hope that you'll become a very loud voice for that.